Imagine a battle being fought within, often in silence, within the very organs that define female health and life. It's a battle many face, yet few truly understand until it touches them or someone they love. Today, we're going to pull back the curtain on malignancies affecting the female reproductive organs, the uterus, ovaries, cervix, vagina, and vulva. This isn't just about medical terms, it's about understanding the silent signals your body might send, the factors that put you at risk, and the incredible strides medicine has made. We'll explore these conditions, not just as doctors see them, but as patients experience them, with the goal of empowering every woman, and every healthcare provider, with the knowledge to fight back effectively and early. At its core, cancer is about cells that have gone rogue, growing out of control and sometimes spreading to other parts of the body, a process doctors call metastasis. When this happens in the female reproductive system, it can feel overwhelming. But understanding these different types of cancers, what causes them, how they show up, and how we treat them, is our most powerful weapon. Early detection isn't just a phrase, it's the key to better outcomes, to more lives saved, and to preserving quality of life. Let's start with a common one, uterine cancer, which often means endometrial cancer, affecting the lining of the uterus. Think of the uterus as a pear-shaped organ, and the endometrium as its soft, inner skin. This cancer typically makes its presence known in a very direct way. Abnormal vaginal bleeding. This isn't just a heavy period, it's bleeding that feels different, out of sync, or, most critically, any bleeding that happens after menopause. If you've gone through menopause and suddenly see blood, it's like a flashing red light demanding attention. It needs to be checked out, and quickly. Some things that can raise your risk for uterine cancer include obesity, certain types of hormone replacement therapy, and a history of diabetes. The good news is, because it often announces itself with bleeding, it's frequently caught early. Treatment often involves surgery, specifically a hysterectomy, which removes the uterus. Sometimes, this is followed by radiation therapy or chemotherapy to make sure all those rogue cells are gone. Now, let's talk about a real challenge, ovarian cancer. This one is often called the silent killer, and for a heartbreaking reason. Unlike uterine cancer, ovarian cancer doesn't have clear, early warning signs. The ovaries are small, almond-shaped organs on either side of the uterus, and their job is to produce eggs and hormones. When cancer strikes here, the symptoms can be incredibly vague and easy to dismiss as normal aches and pains. We're talking about persistent bloating, a feeling of fullness after eating only a little, ongoing abdominal pain or discomfort, and changes in bowel habits, like constipation or diarrhea. These are things many women experience occasionally, which is why ovarian cancer can be so tricky to catch early. It's often diagnosed at a later stage, which makes treatment more complex. Who is at higher risk? Women with a family history of ovarian or breast cancer, those who are older, and especially those with certain genetic mutations, like BRCA1 and BRCA2, should be particularly vigilant. For these women, proactive discussions with their doctors about screening and risk reduction are vital. When ovarian cancer is diagnosed, treatment usually involves major surgery to remove the ovaries, fallopian tubes, and often the uterus, followed by chemotherapy. Moving on, we have cervical cancer, a cancer that tells a powerful story of prevention. This cancer affects the cervix, the narrow neck of the uterus that opens into the vagina. For a long time, cervical cancer was a major threat, but now, thanks to science, we have tools to almost eliminate it. The strong link between cervical cancer and the human papillomavirus, or HPV, is key here. HPV is a very common virus, but certain types can lead to cell changes that, over time, can become cancerous. The incredible news is we have a vaccine to prevent HPV infection, which can stop most cervical cancers before they even start. On top of that, regular pap smears and HPV testing are lifesavers. These tests can catch abnormal cells or the virus itself long before cancer develops, allowing for simple treatments to prevent it. Symptoms of cervical cancer can include abnormal vaginal bleeding, pelvic pain, or pain during intercourse. But often, early cervical cancer has no symptoms at all, which makes screening even more crucial. Treatment options depend on the stage of the cancer but can include surgery, radiation, and chemotherapy. Beyond these more common ones, there are other types of female reproductive cancers, though they are much rarer. Vaginal cancer, for instance, affects the vagina itself. Like cervical cancer, it's often linked to HPV. Symptoms can be abnormal bleeding, discharge, or feeling a lump. Treatment also involves surgery, radiation, or chemotherapy. Then there's vulvar cancer, which affects the external female genitalia. This can show up as itching that just won't go away, pain, a lump, or a sore that doesn't heal. Risk factors include HPV and smoking. Again, treatment typically involves surgery, radiation, or chemotherapy. The common thread through all these conditions, the resounding drumbeat of hope, is the power of early detection. For patients, this means listening to your body, recognizing when something feels off, and not being afraid to speak up to your doctor. It means keeping up with your regular gynecological checkups, especially pelvic exams and pap smears, even if you feel perfectly fine. For doctors, it means being vigilant, educating patients, and knowing that every unusual symptom deserves a closer look. We are living in an era of remarkable progress. The field of oncology is constantly evolving, bringing new and better ways to treat these cancers. From less invasive surgical techniques to more precise radiation therapy, and from targeted chemotherapy drugs that zero in on cancer cells with fewer side effects, to groundbreaking immunotherapies that harness the body's own immune system, the landscape of treatment is transforming. These advancements are not just about extending lives, they're about improving the quality of those lives, giving women more time, more moments, and more hope. The journey through a cancer diagnosis is never easy, but understanding the terrain, knowing what to look for, and recognizing the progress in treatment can make all the difference. Your health is invaluable, and being informed is your first and most powerful step. If you found this information helpful, make sure to check out our next video on coping strategies during cancer treatment.